Hello everyone, my name is Dr. Ayush Jain. I'm from Maulana Azad Medical College and I have secured rank 61 in AIMS PG November 2016, PGI rank 49 in November 2016, JIPMER rank 10 in November 2016, DNB rank 50, All India PG 2016 rank 35 and Delhi PG rank 2. Um, I had joined DAM's test and discussion course, which started on 5th January 2015. Um, the feeling about success, it's I'm feeling great, and the thing is that 1 year, exactly 1 year, last at this point of time last year, I was the one who was opening videos on YouTube and watching videos about toppers who were telling the stories of their success, and it's great to have to be on the other side of the table at this point of time, and to tell you people what my experience as a PG aspirant was. And as far as the strategy for studies goes, I had actually started studying for PG entrances during my third year in my seventh semester, when I actually started to read according to the syllabus of the PG entrance exams. But the studies actually start in the fifth semester, in the third semester itself. Like when you finish your first year you do not, first year is almost the same for everyone. Like you have that euphoria of getting into a medical college, and then you join, like you do your college activities and you're very happy and all, and you don't actually start studying in first year. Whatever you study in first year, it actually gets lost when you reach second year. Everything is almost the same. So second year is the time when you should actually start preparing, and especially subjects like pathology and pharmacology, which form the base of the entire this thing of medicine and surgery and gynae and pediatrics. So you're supposed to read those subjects very well, and that can happen only when you read it during the time when it is supposed to be read. You're not supposed to read Robbins, and you're not supposed to read pharmacology in internship or in final year. You're supposed to have read it when it was supposed to be read. So it is better that you start reading. I'm not saying you start doing MCQs and you start reading according to PG in second year, but then you're at least supposed to read Robbins, and you're supposed to read the syllabus which is assigned for that year. Then after that, like for forensic medicine and microbiology, that is not a very big this thing, but yeah, path and pharma form the basics. Then after that third year, you're supposed to start reading according to PG entrances. You should join DAMs, and you should start reading according to the syllabus of the PG entrance exams. Like you should start doing MCQs. Or I did not start doing MCQs in third year. I was more into reading of theory subjects, because the syllabus these days, things have changed. These years, they do not have the typical repeat MCQs which used to come before. So now they're more interested in practical knowledge, and they're more interested in things, what you see in the wards. Like they want to know how many times you've gone to the wards, and how many times you've attended their rounds, and how many patients you've seen, how many cases you've seen. So that is more important. So in parallel with the studies that you're doing, you're supposed to go to the wards and try to see the cases and then read accordingly. Then for as far as the DAMS experience goes, DAMS played a very big role in, like, when I joined internship. After when I joined internship, then it was like I was kind of lost. I did not know what my competition was, how many people were competing against me, and what kind of like questions were asked, because things change very rapidly every year. Things like this year AIMS exam was totally different, JIPMER exam was totally different. So that's why we're supposed to know what the latest trend is. So DAMS gives you that extra edge. They tell you what kind of questions are being asked very recently, and the teachers out here are so very helpful. Like if I tell you about the Facebook DAMS club, that is something totally innovative. Like no other, I don't think this is the first institute that has this kind of an interaction which is so student friendly, that they know that yeah, Facebook is so people are so active on Facebook these days, so they've taken advantage of that. So it is better. Like when you get bored, when you're on a duty or something, then at least you can open Facebook and you can just see what kind of questions are being asked. Like people ask questions, so at least you can learn from that. And you're not supposed to get frightened by the questions that other people ask. The thing is that, yeah, maybe some people ask those very difficult questions which set your morale down. Like you feel that, oh, I don't know this, I don't know that, and what will I do in the exam? But then you're not supposed to concentrate on the questions that they ask, but the answers and the facts that are posted by the faculty. That is very, very important. And the updates that they post, like sometimes you miss a class, you're not able to go to a class because of whatever XYZ reason, like you have a duty or something, that at least you know the updates, you know the new things that are coming in. Old things you can still read up if you want, but then new things you're supposed to know. So that is what, like Sumer sir posts so many, all the faculty, the entire faculty posts various subjects, everyone posts new things, and you're supposed to read that and try to incorporate them in your notes, or wherever whatever is your last final mode of study, you're supposed to note them there, because only reading won't help. Because see, we can only retain things for some period of time. You are supposed to keep that memory. You're supposed to revise all the things again and again. So it is better that you note it somewhere and then you keep reading it again and again. Like even before your exam, before each and every exam, try to read the same thing again and again. That's how things get refreshed in your mind. Then about the CBT. CBT was a very, very important this thing it was a morale booster for me, because I did not know where I stood before I gave the CBT. Like damn CBT, I gave the exam, and I didn't even expect. I got ranked 75 out of the 20,000 students. So it was a very big morale booster, because before that I didn't know that I stood in the top 100 also. I didn't even expect myself to stand in those top 100 people. So it was I felt that, yeah, maybe then this year something can happen, because from what I had heard from seniors and whatever, that it's very difficult with your internship to crack a PG entrance exam. So even I expected the same. I was like, I'm giving it, but I don't expect much out of it. But then when I got that rank, and it was authentic, because they have the exact exam pattern. When I went to give my All India PG exam, I was very much comfortable giving the exam, even though it was the first time that I was giving the exam. I was very much comfortable because I had given the CBT. So I knew how things work, and okay, you're supposed to go there. There'll be 50 people around you who will be sitting and giving the exam, and in such a nervous environment and everything. So it gives the exact environment. Plus they had 2 sessions, like DNB and All India PG has so many sessions. So DAMS CBT also had 2 sessions. So it was like a proper simulation, and it was like a practice mock test for the final exam. So it was good, and I feel that you should always reevaluate yourselves. Keep giving exams all the time, so that you know where you stand amongst all the people in the country. So yeah, I recommend CBT for each and everyone, and you should give CBT. About the DAMS visual treat, I myself did not attend the DAMS visual treat because I had duties. But then from what I gathered from my friends and what I saw on the cloud, I visited all the pictures and everything that was there on the cloud, and I felt that yes, it was something very big that I missed. And maybe if I would have joined that, and if I would have gone for those 3 days, maybe I would have even gathered even more knowledge. So yes, DAMS visual treat, it happens around September every year, and I think you should go for the DAMS visual treat, and it'll help you. It gives you the entire syllabus of PG entrances in like 3 days. So it is very comprehensive, and yes, high yield for everyone. For the online test series, yes, I did not study according to the online test series, because I just used to go according to the test and discussion course. So like the test and this maybe see if I have a radiology test on Monday. So like the previous week I'll try to read the entire thing. Like I'll try to read radiology within 3 days. I'll try to read Sumer sir's book in 3 days, and then the rest of the 4 days I'll try to revise that. Like I'll mark things in the first 3 days, and then I'll revise for the next 4 days. I'll read those things again and again. Basically what I mean to say is, when you read for the PG entrances, try first read read things fast. Try to read things fast and then try to revise them fast. Like if your frequency, try to increase the frequency of your reading and not your duration. Like people say that I'll read medicine for 1 month and then I'll read anatomy for 1 month because they're weak. But then there's no point. Like you read it for 1 month, no. After 4 days of your completion of syllabus, if I ask you a question from there, you won't be able to remember it. The thing is that you are supposed to try to decrease that duration of 1 month into maybe 4 days. Say I'll read medicine in 4 days. Whatever I'll read, obviously I know I won't be able to retain much out of those 4 days because 4 days is very less. But I'll read medicine for 4 days, then I'll give a gap. I'll read maybe surgery for 3 days, then again I'll read medicine for 4 days. So the frequency of your reading, when it increases, the same pages go through your mind like 4 times, 5 times, 6 times. So then whatever you missed out on the first time comes into your brain in the second time, and whatever you read in the first time will get more and more hammered into your brain in the second time. So basically the thing is that frequency increases the chances of your retaining knowledge. And like if you increase the duration, there won't be much of, like I did not take that pattern of study. I tried to increase the frequency of my studies. So that was one thing. So for the online test series, what I would say is that you read for the subject, and just before 1 day before your TND, like you go for a TND on Monday, so you try to give the online test series on Sunday itself, so that like you know where you're standing before you go for the TND. Because TND also gives you a very like there are lots of students who give the TND exam. Like there are around 600-700 people when you go for the TND. So yeah, you get a very good experience and try to maintain your ranks. But then even if you do not, like I personal experience, I did not. First few tests I fared quite well in the TND. Like I used to get 10, 12, rank 25, 30. That was okay. But then slowly because my internship and because of my postings and all, I did not used to get very good ranks. Like I remember getting ranks even like 250 out of 500 and 300 out of 500. And I used to like the main thing that I want to say is that don't get depressed by these ranks in TND. Like TND is only to like push you, and don't get depressed by what your ranks are. Just try to work on whatever mistakes that you've made. So that is all about the online test series. For the semi-final exam, I was not very aware of the semi-final exam. I just knew that yeah, this is an people are giving this exam, and I should also give this exam. I gave this exam, but I was not very serious about it. I got some rank 1000 or something in that because I did not give it very seriously. I just gave it just like that. So but then it is like it happens somewhere in June or May. So it is like a midway evaluation for your between your entrances. So I would recommend that you give this one also seriously, and try to, even if you've not completed the syllabus, see, the syllabus does not matter. In the end, you'll never MBBS syllabus is so much that you cannot even complete it. So don't ever think that my syllabus is not complete, so I don't want to give the exam, because your syllabus will never be complete, and it is better that you give the exam when a syllabus is not complete. Because the thing is that your syllabus will never get completed only, so you'll never be satisfied. So it is better that you give the exam whenever and wherever you get it, so that you know that yeah, okay, even if someone wakes me up at night and asks me to give the exam, how will I fare? You should know that much also, that you should know what is your standing without preparation also, like baseline preparation. So that is there. Then about the teachers, DAMS has the best faculty that I have ever seen, like I have ever met anywhere. So yes, Sumer sir, Deepthi ma'am, and the faculty, like faculty in orthopedics, faculty in physiology, anatomy, physiology, biochemistry, basic sciences are so important. And the faculty at DAMS, they make it very simplified for you to learn. Because see, medicine surgery everyone can read. Medicine surgery everyone reads in final year, and they do quite well. So everyone knows medicine surgery well. But then the point that makes the difference is subjects like anatomy, physiology, and biochemistry, especially biochemistry. And yes, the biochemistry faculty in DAMS had helped me out quite a lot. And I made it a point not to miss basic sciences in DAMS, because even I had heard from my seniors also that basic sciences are very important, and they're very good. And DAMS faculty and basic sciences are very good. Apart from that, orthopedics faculty, yes, medicine faculty was amazing. And yes, the entire faculty, ENT faculty was very nice. And for my juniors, especially for the juniors, like first I would like to tell the juniors in my college in MAMC that see, internship is fine, internship is heavy, and I know everything is like you're expected to do quite a lot, and it's difficult to uh, study during internship times, especially in Delhi colleges. So I would like to say that it's okay. Like even people like me have, like I was not a very bright student in college also. So people like me have done it. So I feel that yes, everyone else, we have not we did our work quite well. And try that when you go for duties also, don't just sit there just for the sake of it. Like just try to learn things from there also. Ask your PGs, ask your SRs, attend the rounds, see patients. You learn so many things from there. So yeah, because the thing is, the pattern these days is changing. Like you saw the AIMS exam. The AIMS exam this year was complete. It was like an exam in pictures. So those pictures, how will you get the experience of those pictures? You'll never see a hallux valgus or a lumbar puncture needle. Unless and until you've attended DVT or something, you'll never get to see it in books at least. So it is better that you see patients, you go to the ward, and all that experience counts. Basically you do procedures, everything is important, because these days they are asking questions like that only. The JIPMER exam was complete. It was, the entire exam was cases and case presentations. It was all like, a patient comes to you with this, and examination shows this, and what is your diagnosis, or how will you proceed. So basically you should imagine during the question paper also, when you're reading the question paper, try to imagine a patient sitting in front of you, and he has such a so and so condition, and so what will you do next. So that is the thing, and you're supposed to read all protocols and everything. You'll I'm sure that if you attend the rounds, ward rounds and everything, you will manage to get a very good insight of what is happening in the hospital and what is expected out of you. You'll know the questions the professors are they're interested in asking, because the thing is, see, the questions that they ask, like previously people, even I used to hear from seniors that yeah, they're nonsense questions, and they ask all sorts of weird questions and everything. But then when I actually appeared for the exam, I felt that it is not all that weird. See, it is important. Whatever they ask you, it is for a reason that they ask you. They want the first year PGs that have come to them, they, whatever they are faltering in, they want their juniors to be better than them. That is why they want you to learn all those things, and that to come to those colleges then. So that is about the teachers, and about the recommendation to my juniors. For dams, I would like to say that yes, you should like, the moment where you complete your first year, and after that, like, you should start to just have an insight and orientation into what is PG entrance. I think you should the best place to come is dams, because dams tells you what is important and what is not important. See, what is not important is equally important, as important as what is important, because see, the capacity that our brain has is limited, and you're supposed to stuff everything in that, no. So that is why you should try to check out the things which are not important. So dams gives you that insight, and they tell you that what is important. So yes, third year and then second year, and then regular foundation course, and then TND, because TND and after that CBT, DVT, and Facebook Club is very innovative. So Facebook Club is a must for everybody. Then